I come to you in the name of the Lord. Oh, come on, say that with me.
Dr. Joe Tarkan, a Nigerian-born American-based doctor and presiding pastor of the City of David Parish of the Redeemed Christian Church of God in Atlanta, Georgia, spearheaded a team that included doctors, pharmacists, nurses, and ministers of the gospel from both the United States and various parts of Nigeria to Ugab in the Yakurr area of Cross River State. The mission themed Jesus Heals took place from the 13th to the 16th of December 2023 with focus on 3 key areas: leadership training, medical outreach, and an evangelical crusade. On the 14th of December, the team undertook a dual initiative. The first group headed to the Ugab General Hospital for necessary arrangements and registrations for the medical outreach, while the second team, led by Dr. Joe Tarkan, paid a courtesy visit to the palace of the Obal Lopen of Ugab, His Royal Majesty Obal Ofem Hubara. In adherence to tradition, Dr. Tarkan made his intentions known to the king, a gesture warmly received.
We came in here for three primary reasons. One primary reason, to be a blessing to Yakurr and the environs, to be a blessing to give what God has given us, freely and gladly and willingly. We came here to accomplish 3 things. Number 1, to train some of our people on leadership development. Number 2, we also came in here with a medical team. A medical team who brought some and some who are local. We are trying to bring the message of Jesus Christ and his free gift to mankind to the community.
So I'm happy to have you. I'm happy for what you have come, the great things you have come to do for our community. I pray that our children will see the word of the best. So that our town will change from its ugly name to a new name. I thank you for coming. I pray that what you have come, the aim of your listening will in Jesus. Amen.
The king became the first beneficiary of the free medical care, setting the stage for an event poised to transform numerous lives. Simultaneously, at the Ugab General Hospital, registrations began as hundreds of patients received cards in numbers. Amidst this process, the gospel was preached, leading to many dedicating their lives to Christ. Leaving the King's Palace, Dr. Tarkan and his team came straight to the Ugab General Hospital for the medical outreach.
I'm born a twin, and I grew up in a missionary environment where there was a missionary hospital across the street from our home. And a lot of people used to come and live in our home who were attending the hospital. So from one as a child, I loved the passion for medicine. I love the passion for medicine. And then, became a Christian, considered the fact that I'm a twin and I could not have survived but for the efforts of Mary Slezo, who came and lived in this part of the world. That's how I survived. So for me, as a Christian, and when I considered the fact that when missionaries came, they came with 4 things. They brought hospitals, brought schools, brought church, and brought Coca-Cola. I say that today we cannot be Christians who have benefited from missionary endeavor and we don't do anything to help our people the way others helped us. They sacrificed their lives, they lived here, they died here. Today, those of us who have grown here, who have had the benefit of a good education, good exposure, having gone through the benefits, again, provision provided by missionaries, the least we can do is to give back to our people and help them either medically and in every aspect that is possible.
My people are destroyed for lack of knowledge. It was imperative to educate the people on simple ways to maintain healthy living.
I tell people you're your own best doctor. And what happens to most people is that they don't do right because they don't know right.
Dr. Joe Tarkan, alongside Dr. Adeshola Kwitan, commenced the first item on the agenda, health education.
Now, I noticed that there are some places where you have tap water. Okay, if you are not sure about the quality of the water, boil the water. And then if you're a woman, make sure that you clean yourself well, that you don't have infection.
They say cleanliness is next to godliness. That will help us keep mosquito away.
They counseled the community on health-friendly dietary and social habits, emphasizing self-examination to mitigate various health conditions, and answered questions from participants.
Before daybreak, they will go to urinate about 5 times or more. That she wants to know what is responsible for that.
Let us check you for diabetes.
I've not had low BP emphasized. That is where what I normally suffer. We only take local way. This salt, anytime I take it, much it will rise my blood.
What BP do you consider low BP?
Sometimes you see 103.
Over what?
Over 60, over 60.
That is not low BP,
Not
sir.
low BP.
Okay.
That's normal.
That's your best condition of health.
While the health education continued, patients were allowed one after the other to meet the nurses so that their vitals can be taken.
Today is just medication, just seeing their vitals, consultation, and seeing what we can do.
Following this, doctors began seeing patients, recommending free exams at the hospital laboratory before prescribing medications. Despite early planning, a serious delay in delivering medical supplies from Lagos to Ugeb occurred.
The medications that we ordered, they left Lagos since Saturday.
Undeterred, the team pressed on with medical consultations, aiming for a target of 100 patients per doctor.
He has been down for a year, and when we heard about this free medication, we had to come over to see if there will be any difference. By God's grace, at least she has given me a clue on what to use on the leg and the things she should not eat while treating him.
It's like we've surpassed the target. We didn't expect as many patients as this. And that tells you the level of our primary health care.
After several interventions, the much-awaited medical supplies arrived.
Well, yeah, we ordered medication. We spent almost 2 million naira getting medication. Hopefully, our plan is that whatever we don't exhaust, we're going to donate that to the hospital. My expectations are being met and exceeded because the volume of patients we have seen is beyond what we thought we were going to see. But from what I'm being told, that tomorrow we're even going to have a bigger crowd.
The next day, as expected by the medical team, more people came into the hospital to be attended to. Dr. Iyangediva, the medical director of Ugeb General Hospital, led his team to commence surgical procedures.
For surgery, we already have about 50 booked as of yesterday. We believe that at the end of the day, we put smiles on the faces of people who cannot afford Medicare.
Due to delays experienced in the delivery of medical supplies, patients who went through medical consultations were asked to come pick up their drugs at the pharmacy unit.
I'm thanking them. I was sick for more than 10 years now, since I don't have money. When I've seen where free treatment is, that is why I'm here.
People here are appreciative of this free service, and people who are at home, you might think you don't have enough, but coming down here, you'll be appreciative of what you have, and the fact that you have amenities, you have good healthcare services back where you are watching this from. Here, it's a privilege to see a doctor. Because every time they come to see a doctor, sometimes they have to spend money that they don't have.
At the end of the day, the pharmacy unit dispensed medications to a total of 420 individuals, while the surgical unit conducted successfully a total of 53 surgeries. In keeping to their promises, Dr. Joe Takan and his team handed over unused medical supplies to Dr. Iyangediva, the medical director of Ugeb Hospital, further solidifying the collaborative effort between the mission and the local healthcare infrastructure.
Like I told you, these medications were worth over, at least what was on paper initially was 1.6 million, but we had to buy more. So this medication was over $2 million naira, and we used less than half of them, just about 1/3, as I was told. And but whatever has remained here, we have like 289 bottles of PCM syrup, 92 bottles of amoxicillin suspension, 136 bottles of flagyl suspension, nifedipine, 12 carts of 3 each, 90 bottles of ibuprofen suspension, 675, what is this now, Felodine Plus, quite a cascade of them, Glumac tablets, 145, Vasoprym 70, 800 tablets of diazepam. We have, antibiotics, a lot of them, saline gauze, fibrils, and all that. So amlodipine, antihypertensives and all that. So all of that has remained, and we don't want to take it away. We want to hand it over to the hospital. Dr. Ideha, thank you so much for working with us and helping us. On behalf of Vital Health International and Africa Missions Global, we want to give this over and just hand it over to you so that you continue to use it for the practice in the hospital. Thank you so very much. Vital Health International, Redeemed Christian Church of God, City of David, and Africa Missions Global.
Thank you very much. We are not able to meet up with the health challenges of our people because of the financial challenges and the pain. You have mentioned the problem of so many, and we're so happy. We want to assure you that whatsoever you are left behind, we are going to use it judiciously to put smiles on the faces of our people. So thank you very much.
Thank you. And the remaining patients who are due for surgery, we've said about 30 of them, we are trusting that by Monday you'll go ahead and do the procedures that are necessary. Yes. We'll make our commitment, we'll make our contribution as is necessary. So it's both ways, contribution from you, from us, from government, and everybody. Make sure that that's also. Thank you so much.
Thank you.
God bless you.
Hello, this has been an amazing experience, and I trust that you enjoyed that. God bless you. See you next year.